Mayor London Breed, San Francisco, going down a road of accountability for welfare recipients testing for drugs in their system? What? Hey now. This is San Francisco. We're pitching this. This is the mayor of San Francisco pitching this. I've been talking about what London Breed's been talking about. Haven't seen it come to fruition yet, any of this stuff, because we're just on the forefront of maybe making some changes to the way things are going in San Fran. Anything at this point in time would probably be a positive, right? So what's London Breed? What is she saying? And she is not getting a positive reaction from her fellow supervisors in San Francisco. Let's get into it. What's she saying? Here we go. San Francisco voters to decide on plan to screen welfare recipients for drugs. What do you think most of the voting public in San Fran's going to say to that? Hell to the no. Why are you picking on the mostly peaceful, mostly sober drug addicts littering our streets with homelessness, drugs, crime, human trafficking, you name it, garbage, poop, urine, you name it, littering the streets of San Francisco? Why would you pick on those people and force them to get some accountability? Why would you do that? That's terrible. That's not humane. It's exactly what needs to happen. Hey, if we're going to give you a few $100 a month, and we'll find out here in a second exactly how much it is, I think you might be surprised. You're like, what? For being a drug addict? This is what you get paid? Huh. All right. I know some of you are going to be like, all right, let me run the numbers here. Let's see. What's a tent cost? Okay. I don't need a car anymore. Yeah. All right. I can get by. Yeah. Free food down there. You bet. Where isn't there free food now, right? It's just a thing. Yeah. You can get a free tent, get a free blanket, you name it. We'll bring it out to you. We'll toss it at you. We'll toss you a sandwich. It'll hit the side of your tent and do that, thing where it drops onto the ground. No, Mayor London Breed is saying exactly what needs to be done, and she's going down paths that will work. I don't think she has the backing. She doesn't have the political will of the people to support what she's saying, because what she is recommending is so opposite from all of the policies, the years and years and years of policies that have gotten San Francisco, that have gotten Portland, that have gotten LA, that have gotten Seattle where they are now, which is that certain areas of town are just cesspool. They're just rife with this nuttiness, to the point where there's YouTube channels, there's Instagram channels, there's Twitter accounts that all cover just the basic depravity of human beings that are living on the streets in these blue-run cities. Following a chilly reception at the Board of Supervisors, San Francisco Mayor London Breed said Tuesday that she is placing her proposal to screen welfare recipients for drug addiction on the March 2024 ballot. First announced last month, Breed's proposal would affect people enrolled in the city's General Assistance Program, considered a safety net that provides up to $687 per month to indigent adults, poor people, right? People that without means. Recipients who are suspected of a substance use disorder would be required to undergo a drug addiction screening and agree to participate in a treatment program in order to continue receiving benefits. That almost sounds reasonable. What's going on here? It's not that hard to figure out, is it? We've been talking about it forever, because this is the endless discussion. You got to have some repercussions for poor decisions. You make a decision, here's the end result. You decide to live on the streets, you're going to have some issues. Society can't just fund your drug addiction because that isn't working out well. And a lot of this has to do with the overdose, the fentanyl overdose issue. Right now, it's between 2 and 3 people a day in San Fran are dying from fentanyl overdose. So you've got this look that isn't great. And then you've got just street after street. You got the whole Tenderloin area. It's overrun with drugs. And then the lifestyle that brings, the garbage, the foil, the smoking. All right. Nobody wants to ride the public transport anyway. It's part and parcel of this whole thing. And a lot of folks, a lot of reasonable people say, hey, if you want to give them housing, that's fine. But, they can't be on drugs because those folks aren't going to be able to handle a normal lifestyle. But the issue is that in all the cities where this has become really, really prevalent, you don't have involuntary anything. You don't have that. Mayor London Breed is talking about that as well. She's talking about, we need to bring back the ability to involuntarily commit somebody for mental issues or massive drug addiction issues, because otherwise we're just letting people die out on the streets. And that's happening on her watch. And I think that'll continue through her watch. She will start to get some of the traction if the residents of San Francisco want to go down the road of maybe trying to actually help their fellow human beings who they're letting live these depraved lifestyles on the streets and eventually just die. Because, it's not going the other way. People don't just pop up after 20 years and go, you know what? Today's the day. I think I just want to go into treatment. The drugs that they're doing now are so much stronger. This ain't your daddy's heroin. That's what I always say. Because whose dad did heroin? Well, there's going to be some keyboard warrior. Sean, my dad did heroin, and it was terrible. That's not what I'm saying. What I am saying is heroin that your dad took in prior generations was way weaker than what we're dealing with now. Fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. So, and it kills you. It can kill you. Small little batch, little tiny, just a couple of milligrams can put you down. Yeah, if it's loaded. The ballot measure would require a simple majority to pass. Will the residents of San Fran enact this? We keep hearing, I'm so sick and tired of this. Why doesn't somebody do something? Okay, here's your something, San Fran. Let's see what you do with this. You are being just lobbed a softball in there. If you just hit it a little bit, yeah, you're going to see noticeable changes, because when people don't have this money, it doesn't fuel you don't have the money in the system to do the drugs. Now, where I would say, and a lot of people always ask, well, where do you get your money for all these drugs? Well, I get assistance, 600 something bucks. And in today's drug culture in these towns, that buys you a lot of drugs. Even if you're getting a couple $100 a month, that is a fair amount of drugs. And then you just turn to prostitution or stealing and, you make up the difference. That's what you do. No, Sean, these poor people are just living in tents. They're so close to making it back, getting back into society. No, they're not. They're not even close. The vast majority of them, they're not even close. They are deep in the throes of opioid addiction. And you know how we know that? The number of people dying from it. Way over 100,000 people a year. It's like, well, that's not good either. No, it's not. It's terrible. It's horrible. This ballot measure will allow San Francisco to add another tool to our efforts to address the drug use that is creating serious public safety hazards, because you allow people to live willy-nilly wherever and fueling an overdose crisis on our streets, said Mayor London Breed in a statement. And what I was going to go back to up here was suspected of a substance use disorder. How do you quantify that? What does that mean? That's part of what I don't know. But you know what? Hey, if you're going to get housing, if you're going to get free money from taxpayers, that's fine. But we're going to need you to take a P test randomly once a month. And if you don't, boom, you get cut off. Now, for most of this population, they're not going to be able to do that. So then they're going to get cut off. Well, choices, decisions we make. have repercussions? That would be some of it. The ballot measure would require a simple majority to pass. Breed's proposal drew sharp blowback from several members of the Board of Supervisors. And those members of the Board of Supervisors are the reason San Francisco is as bad off as it is, because they perpetuate this ridiculousness. Oh, we're just, we want to let our own people make their own decisions. Harm reduction. The whole concept of harm reduction, meaning, well, we know you're going to do drugs, so we want you to do it as safe as possible. Here's your chapstick for all the smoking you're going to do. And here's that clean needle for the heroin, because we don't want you to get, some kind of transferal from your fellow drug users, intravenous drug users. We don't want that. And it's like, you're not helping anybody. You're just making it easier. You're just giving them a clean needle to do their thing. Well, now it's foil, right? Oh, let's give them a whole bunch of foil, because nobody's doing needles anymore. I shouldn't say nobody, but the vast majority of people have switched from heroin to fentanyl because it's stronger, cheaper, and it's a better high. So you got several members of the Board of Supervisors who called Breed's proposal punitive and detrimental to those struggling with addiction. So in other words, you're going to hit you over the head with more punishment. So that's the attitude. And that is how you get where San Fran is. That's how you get where areas of Seattle are. This whole concept of harm reduction does absolutely nothing. It actually increases the ability for people to further abuse drugs. But harm reduction states that, being sober may not be an option for these people. So they are wildly in opposition to this, because it goes against the fundamental concept of, free will. Everybody gets to do everything. If you just want to sit on the sidewalk and panhandle and take a poop right there and a pee right there, and we'll come and clean it up for you. And then if you leave your garbage everywhere, we'll do that. And somebody steals your tent, we'll bring you out one. And, food just down the corner. You can go down there and get it, and you're all good. And just keep, using your taxpayers' money for your drugs, and it's all good. So in other words, you're going to hit you over the head with more punishment, said Supervisor Hillary Ronan during a charged discussion at the September 26th Board of Supervisors meeting, pointing to an apparent shortage of drug treatment options. Other policymakers worried about the feasibility of the plan. Agreed. Most of these cities have a massive, massive shortage of detox centers, health care workers that specialize in treatment of, addictions. State of Oregon is the worst in the United States. It's got one of the biggest problems. It's got the least ability to counteract that with actual medical intervention, because with the opioids, there's a number of drugs that can make coming off of it easier. Doesn't mean they're going to stay off of it, but that initial detox. Now, what you've got going on with like speed and cocaine, those aren't opioids. You don't have the same ability to get folks off. And the meth that's out there, the clear that's out there is, it's just nasty stuff. Rots out your teeth. After being up for 4 or 5 days, your mind starts to trick you that you got all kinds of bugs crawling on you. And that's why you see all those sores, because they literally think that they're scratching a bug that's eating the surface of their skin. And then they just dig into it, and you see all these, that's why you see the skin the way it is, because those people literally in their minds, their body is telling them, their minds are telling them, I've got something really itchy. I need to itch it. So they do till it bleeds, and then they just keep coming back for more. So feasibility of the plan. Yeah, that's definitely a concern, but this is a start. Under the mayor's proposal, treatment options could include residential treatment, medical detox, medication-assisted treatment, outpatient treatment, or other options, depending on the needs of the client. Vast majority of these folks are, number one, going to need straight up detox, and then they're going to need inpatient, and then they're going to need outpatient, and they're going to need housing. And we're really not set up to do that. Just not set up to do that. It's going to require millions and millions and millions of dollars to get there. We barely have enough money for just straight housing. We don't have that. But if you went down these roads, get people off, get them unhooked from the stuff that they're on, it's the only way you've got a fighting shot. Letting them be on the streets, that's just exposing them to the odds going up exponentially that they will overdose. So, clients who do not engage in the addiction assessment will no longer receive cash assistance, Breed's office said in a statement. I'm all for it. I say yes, absolutely. Because that is one of the biggest complaints I think everybody has, is that there is, you want all this stuff. All right, what are you going to do to earn it, to get it? Because everybody else in society, you want a house? That's fine. You got to earn it. You got to go get it. You got to get the income together. You got to get the credit together to get it. You want a car? You just steal it. You're a Kia boy and you just, put your phone in there with the USB and take it. No, anything legally obtained, you're going to have to earn, right? You're going to have to get together some money and do that. But the enormous argument is that there is no accountability for the drug usage in housing. This housing first concept, which is, well, when you get them the housing, that's when they'll stabilize their lives, they'll sober up, and they'll become normal functioning members of society. Is that happening with the vast majority of the people in tiny homes? It's not. Hearing more and more stories about people who just don't even go to their tiny home. They checked it out. They looked at it. It's in a location far away from their hood, where they know they can get their drugs, where they know they can sell their stuff, where they know they can steal from their local Target comfortably. If you don't have those things, it's much tougher to operate. And then you're going to throw on top of that a little drug testing. It's a little bit of pushback for a system that should have never been put in place in the beginning, which is, hey, we'll just give you everything you need to live this debauched lifestyle of addiction, and you can just make that your decision as an adult. That's how you're going to live. So those who are discontinued from the assistance will receive housing assistance for 30 days and may be considered for an extension of housing assistance if necessary to prevent eviction. Okay, those are the details, right? The broad strokes are, we're going to need to test you, and I'm all for that. Accountability. We need it. Our kids need accountability, right? When they're little. That's how you get them up to not be mass murderers. All right, you can't do that. No, you can't do that. Can I do this? No, you can't do that either. No. And if you do that, back in the day, we used to say, I'm going to kick your ass. And you meant it. And then your kids are like, oh, my dad's going to kick my ass if I do that. Therefore, yeah, the message here, if I'm clear, is that I'm not going to do that. But instead, in all these liberal cities, the message is, come on, be a drug addict in our city. It's great. Just live in a tent, live in an RV, live in whatever. Just do your thing. So you've got some assistance for 30 days considered. If this got implemented, this would cause some fireworks. I think this has a snowball's chance in hell of getting through, of the population enacting it. San Francisco, prove me wrong. I'll talk about it all day if you do. Prove me wrong. According to the San Francisco Human Services Agency, which runs the General Assistance Program, 20% of recipients self-disclosed a disabling addiction between 2018 and 2020. Okay, when I saw that number, so 1 out of 5. And I thought, okay, is that a high number? Because they're just self-disclosing. What is that number in reality? 80, 85%, edging on towards 90? Because when you hear other addicts talk about, well, how many people involved in your encampment are on drugs? They typically go, everyone. They're all involved in drugs. So 20% of recipients self-disclosing. Okay. Very low number relative to probably the actual number. But even when they're just asked, hey, are you on drugs? 1 out of 5 says, yep. Yes, I am. General Assistance Program administered $30.3 million in fiscal year 2022. And there are currently about 5,200 people enrolled in the program. The General Assistance Program is required under state law and funded locally. In a statement, Human Services Agency's Executive Director Trent Rohr said that the goal of Breed's drug screening initiative is to reduce drug-related addiction and overdose deaths amongst those who come to our agency for help. All right. Game on. Do it. I mean, that's kind of my thought. Anything in this direction is a step forward. This whole harm reduction, yeah, that's nothing but a bunch of nonsense. We want to look at all potential solutions and do everything we can to support clients who have substance use disorders by motivating them to get the help they desperately need, which we hope will lead to them to addressing their substance use and achieving stability and well-being in their lives, he said. All right. Unfortunately, for so many people out there, for my son who passed away from taking what he thought was probably a Xanax, and it was probably loaded with fentanyl. We don't know because his death certificate says natural causes, but he was a healthy 27-year-old and he didn't have a heart attack. He didn't have any of that. They don't really know what killed him, but he did have 75 or 100 Xanax pills, street Xanax pills on him when he died. So, and we're in the midst of an, fentanyl overdose crisis, especially in Seattle. And he had a text, he had been given a heads up, hey, there's some bad stuff going around. So knowing all of that, odds are, for the vast majority of these people that are out there hooked right now, it's a massive uphill battle to probably come back around and be a member of society that is productive. That's tough. And also what we also don't know is the mental impact that the long-term use of these drugs, particularly the fentanyl, has on people. I mean, we are seeing some folks that are, whether it's the meth or the xylazine or whatever, you're seeing some people with some behavior, people running around whacking each other with metal poles, people chasing each other with just crazy stuff going on. People running around that are naked, people holding naked people down that are trying to run around, touch their children. We had that in South Center Mall the other day. Big naked dude trying to touch the children. Some parents are like, no, I don't think you're going to probe my child, Mr. Meth Head. We're going to chase you out of the mall. You got some stuff that is really, we talk about tweakers, the term tweaker, somebody on speed, somebody on clear. It changes their minds. It literally makes them these creatures that, to me, all right, that person is pretty far gone. They need support as well, even though they've made these choices, and letting them just die out on the sidewalks. A lot of you say, hey, that's what you should do. Round them up, put them on an island, and let them battle it out. All right. What if that was your brother? What if that was your sister? What if that was your mom? What if that was your, daughter, whatever, grandson, granddaughter? What if that was your kid we're talking about out on that island, just getting ravaged and having drugs ravage them? That's where it starts to break down. Well, I guess it just wouldn't, no. But that's already happening out on the streets. We're hearing more and more about the economy of living in homeless encampments, and it does not go well for the females. They get wildly taken advantage of. And because sex is a commodity, they can sell themselves for small amounts of drugs. And that happens. You hear that the tent whores, the tent hoes that just go from tent to tent and, get their addiction taken care of. And the guys get their needs taken care of. And, it's not a conducive environment for humanity. Let's just put it that way. So anything along these lines, I'm all for. I don't think this will go through, but this is kind of the first we're hearing about it in a major scale. Hey, we're going to throw this on the ballot and we're going to see what happens in this current fentanyl crisis. We've heard about this kind of stuff before, but not in a city like San Francisco. And so Mayor London Breed going down some kind of more tough love approaches. We'll see if she gets some traction. I don't think it'll happen, but I'm going to talk about it because this is what should happen and needs to happen. But I don't think it will, because this is one of those things we're going to have to work our way into it. More people are going to have to die. And then society might wake up. I say might wake up and go, you know what? Maybe this just isn't. Maybe that 250,000 people we had die from drug overdoses last year. Maybe there's actually something we can do about that. Huh? Weird. Nah. Give them a tent. Let them go for it. Feels like that's what's going on, right? Yeah, feels like that's what's going on. All right, that's it for me on this one. Thanks so much for being here. I'll catch up with you in the next one. Bye for now.